Everybody. Welcome. I am happy to have Nancy Schwartz here with us tonight. Not only is she a very sweet lady, but she works very hard to match people up with the right kind of Medicare coverage. And tonight she's going to help us sort things out. And so I'm going to ask you to, if you're not already, to just mute yourself. It looks like everybody is. And you can put your questions in the chat. We're going to have a Q&A session at the end after you've heard everything. I will pull out the questions to ask Nancy. And this meeting is being recorded, so if you want to see it again, you'll be able to. To see Nancy's presentation the best way, make sure if you go up to the upper right-hand side in view, you want to be in speaker. You want to choose speaker view. And I'm going to keep an eye on the chat box. And without further ado, welcome, Nancy.
Well, thanks, Joanne. It's really nice to be here. And as I was saying to the early arrivals, it's kind of a real treat to see so many familiar faces. And, this is something I'm really passionate about, and I'm really so glad to be able to, I hope, make you feel more at ease and give you an understanding of the basics so you're very equipped or more equipped to walk into the world of Medicare. So as Joanne said, you'll be very happy to hear this. I'm not going to be talking the whole time. I do have some slides. I'm going to introduce you to the basics of Medicare. You're going to have a lot of questions, and I know that, but I'm really taking sort of an overview approach because I want you to understand the big ideas, the big basic ideas. And as you drill down into it over time, that's not what we'll do tonight, but having the big understanding in place is going to give you entree to understanding all the nitty gritty that you need to make decisions about. So here we go. And as Joanne said, we're trying to just go straight through because really this presentation, each idea builds on the next. So if you have questions as we go along, please do type them in, when they're top of mind into the chat box. And then Joanne's going to feed those to me afterwards. And of course, I'm always available individually to answer your questions as well. So without further ado, here goes. Okay, so as Joanne said, I am all about Medicare. I made a career change to Medicare a couple of years ago after having shepherded my dad, Manny, through a lot of years towards the end of his life, but in particular, when we brought him up here to live from Philly, and I became very hands-on with that. I became aware and very grateful for the fact that he had taken some advice, which is not something he was want to do, but he somehow had gotten some good advice and had Medicare coverage in place that gave him access to the doctors he and then I preferred for the healthcare he needed without financial ruin. So that was an important part because he lived to 94 years old. So I got very inspired during that experience to make sure that others had access to the same kind of healthcare. And at the same time, I recently turned 60. I saw that ahead and I decided this was a great direction for me to go in career-wise. So a couple of years ago, I made the change and I'm all Medicare all the time in my working hours, that is. I'm a do have some other interests beyond that. Whoops, sorry about that, jumped ahead. The question that I'm always asked is, what is the best Medicare policy? What is the best plan there is? As if I have a secret that nobody else knows. Well, I am actually, and I meant to say this, I'm a Medicare broker. That means I'm an independent insurance broker. I represent the client. I'm contracted with all the top insurance companies. That gives me the flexibility to choose the plan that's best for you from whatever company offers it. So when I get asked, what is the best plan out there you should know, I say there is no best plan. And this is really the most important thing I would love for you to remember as you move into this Medicare journey, is that there is no best plan. So if your friend has a plan that she loves, or your cousin has a plan that he loves, whatever they love, that's great. And I'm happy they're satisfied, but it has nothing to do with what's right for you. So one of the things we're going to learn today is what are the elements you should be considering when you're looking at Medicare? Oops. It's a challenge, of course, to choose healthcare coverage, especially when we're in this age where costs are skyrocketing. Comprehensive healthcare, it has to fit both your needs and your wallet. And very frankly, most of us aren't used to choosing our own healthcare. If you've worked for an employer and gotten healthcare that way, maybe at most you have a couple of different plans, cafeteria, to choose from. But to start from scratch, especially in the world of Medicare, which we all know or have heard of, whether we're there or not, how murky and messy it is. It's daunting and it's really overwhelming. So I want to really congratulate you for actually thinking about this and taking the step to be here with me tonight to learn about it, to empower yourselves with the knowledge. And like anything else, whether it's buying a car or figuring out how to do your taxes in the way that's going to save you the most money possible, it's a matter of learning how. And also, if you need to, you ask an expert. So you're going to leave our info session tonight clear on what to do next and empowered to make the right Medicare decisions for you. One of the reasons that Medicare is so daunting to so many people is that it is a complex system. And it's not what you think. First of all, it's a blend of public and private insurance programs. It's not free. It doesn't cover everything. And it has a lot of very strict rules, many of which are very confusing. As a result, it's all too easy to make a mistake. And that's the word that gets around. That's why I hear so much of that when folks come to work with me, that they're really so afraid. They're very anxious about making a mistake. They had a friend who had to pay a lifelong penalty because she didn't enroll in time, or they had another friend who missed the beginning of her coverage and didn't have any healthcare coverage because she didn't set it up at the right time. So we're going to really inform you on what needs to be done when, so you're not going to run into those mistakes. I'm going to introduce to you actually a 3-step solution to the challenge of connecting with the right Medicare coverage for you. The first is we're going to start tonight, and that's put in the work to understand Medicare. It is confusing, but there's some basic concepts that once you get them, and you're going to have a good start tonight, it's really going to enable you to go from there. You don't have to know everything. The second is based on that understanding of Medicare to prioritize your needs. Like any other significant decision, you can't have everything. And the clearer a sense you have of what's important to you in terms of your healthcare coverage, the better you're going to be able to match those priorities up with the right policies and plans. The third thing is that you don't have to do it alone. The field I'm in is really nascent, and a lot of people haven't even heard of brokers for Medicare, but there are other experts as well who can help you. So I urge you not to do it alone. Do what you need to do to be able to articulate your priorities, and find a knowledgeable expert who can take you the rest of the way to the right coverage. The first step is, as I said, learn to understand Medicare. The most important thing you have to understand first is who is eligible for Medicare. So you need to be a US citizen or have been here as a legal resident for at least 5 years. There's no Medicare. The timetable for Medicare is different than it is for Social Security. It's 65 up. And if you're working at 65, you want to consider what kind of coverage you're going to have. If your employer has more than 20 employees, then it's likely you're going to want to stay with that coverage. Otherwise, well, that's a detailed road. I get into it individually with people. If you work for an employer with less than 20 employers, it's really easy. You enroll in Medicare. This is a really tricky part. You probably heard of all of the parts and plans of Medicare. Well, these are the 5 parts. And you notice that we're going to break them up. I'm going to explain them to you, starting with parts A and B, which are what I call original Medicare from the government. And then I'll show you how the other parts come into play. But one thing at a time. Original Medicare is a fantastic program from the federal government. Part A is hospital insurance. It's not everything, all the care you get in the hospital. It's basically room and board. It requires an overnight hospital stay with admission. So if somebody on Medicare is in the ER overnight, there are no rooms available, no Part A goes into play. Part B is all of your everyday medical expenses, your visits to doctors and other medical providers, blood tests, labs, all that kind of thing. Any medications administered in the office. That's not an all-inclusive list, what you see here, but it gives you an idea of what's covered. And of course, both of these elements work closely together to provide pretty good coverage. Original Medicare is a great program. Every hospital in the country is part of it, and about 96% of physicians are part of it as well. But there are a lot of things that aren't covered by Original Medicare. I mentioned up top that it's not free. Now, Part A for hospital stays, if you've worked for 40 quarters or more throughout the course of your life and have paid taxes on that work, then you've already paid the premium for Part A in your FICA taxes. But beyond that, there are deductibles for both in-hospital care and for follow-on skilled nursing care. By the way, don't worry about jotting these down, these figures. I'm going to send you in a follow-up email an outline, a clear outline of all the deductibles and premiums, et cetera, associated with original government Medicare. So Part B, though, you do pay a monthly premium for. That monthly premium begins at $148.50, and it actually goes up depending on your income. In addition, you have a $203 annual deductible, and there is an 80/20 cost share. So you're always responsible for the 20% of a doctor's fee, a physical therapy session, an MRI. So that can really add up. In addition, here in New Jersey, our medical providers are able to tack on it what's called an excess charge of 15% if they want to. If they typically charge more than Medicare pays for a specific procedure or visit type. So honestly, you're actually subject to about 35% of a fee, and that can really add up. Whoops, sorry. Whoops. So, having a little trouble here. I apologize for that. Human error. So those are parts A and B, as you see at left on this chart. Next, that prior slide and may have raised the question, okay, so all that stuff isn't covered. That can be if you have medical conditions, even ongoing medical conditions, much less you are in the hospital for something, that can be add up to quite a lot of expense. There are a lot of gaps. So to fill these gaps, a couple of solutions have been developed, and they involve Part D, Part C, and Medigap, Medigap or a Medicare supplement, which doesn't even get a part, but it has plans in it. There are two ways to fill the gap. The first, on your left, is what's called a Medicare supplement. It works in conjunction with original Medicare, and that's the kind of card you see at top left, the red, white, and blue card. And so you also need coverage, but it is only for medical coverage. It does not include drugs. So for your medication coverage, that's where Part D comes in. And Part D is a medication-only insurance policy. So if you choose the solution on the left here, you're basically covered by three policies: original Medicare, a Medicare supplement, and Plan G, just throwing it out there, no need to remember it, is the most popular one, and a Part D prescription drug plan. Those work together to fill the gaps. An alternative that's been developed more recently is Part C, aka Medicare Advantage plan. And about 99% of all the advertising and promotion you see about Medicare is about Medicare Advantage. Medicare Advantage is structured really differently. It's a total replacement for original Medicare. In fact, Medicare Advantage plans take over the management of your original Medicare components. You still have to pay those premiums and deductibles to the federal government. However, they are managed by your Medicare Advantage insurance provider that also provides some coverage to fill those financial gaps. Typically, what this looks like is more like your under 65 health coverage. You have one card. It's usually a very limited network, whether you're in an HMO or a PPO. It sort of works like a payphone. You don't pay anything up front a lot of the time. And that's very, very attractive to people. Zero premium. However, you're dinged for every single healthcare usage you have. And that can really add up. You're also limited geographically with a Medicare Advantage plan. Typically, you need to get care within your county. And a recent client of mine actually was able to change from her Medicare Advantage plan to a supplement plus drug plan. One of the things that motivated her to do that was that she had cancer a couple of years ago, and she wanted to go to Sloan because she had in the city, she had a relative who worked there. Or a lot of people just like to, if there's a serious medical condition, go into the city and go to an expert. That's one of the blessings of living so close to a medical center like New York City. You can't do that. Well, you can do it, but it's not covered with Medicare Advantage plans. But you do have lower premiums there. And you are protected by what's called a maximum out of pocket. And this year, it's the cap on your expenditures out of pocket. This isn't premiums. It's not your Part D deductible. Excuse me, is $7,550. That's a lot. I'm a fan, and this is just me, it might not be the solution for you, of Medicare supplements. Medicare supplements are the plans, and right now there are only two you'd consider, G or N. The plans are designed by the federal government, so they're standardized. And you can easily compare what a Plan G looks like across different insurance companies. You're looking not only at price, but there's some other factors like the financial stability of the company and how frequently the rates go up. And you can see that because a Plan G is a Plan G, no matter who it comes from. On the other hand, Medicare Advantage plans, each one is a very unique shape, a very unique set of benefits, co-pays, and all of that. It's almost impossible to compare apples to apples there. So with a Medicare supplement, that's more like an unlimited mobile phone plan. You pay up front, you limit your risk, and you can project exactly what your healthcare budget's going to be for the course of the year. So those are the two ways to fill the gaps. Enrollment, of course, is really important because you want to avoid the penalties that can come when you delay enrollment, or even if you don't have a penalty, if you enroll late, you may be subject to a delay in coverage. So a certain period of time where you don't have coverage. So when do you enroll at 65? If you're a gig worker, you run your own business, that's not an LLC, you're retired, you or your spouse, if you have a spouse, nobody in your house who's an adult in a partnership has coverage through an employer or a union. If you're on the exchange ends at 65. And if you're working with an employer that has less than 20 employees, those are absolutes for enrolling at 65. It's ideal, and I'm going to urge you to always go to enroll in both, whatever parts of Medicare you're getting involved with as early as possible. So you can apply for Medicare 3 months before your 65th birthday, or if you're working past 65 and then retire, 3 months before the end of that employer coverage. The first step you have to take is to enroll in Original Medicare, whether you're going to go for a Medicare Advantage plan or a Medicare Supplement plus drug plan. You can't enroll in those until you're enrolled in Original Medicare, the government Medicare, and you have your Medicare number. That's the key to everything else. This chart shows you what is promoted this 7 months around, centered on your 65th birthday, what is promoted as a period when you can enroll. However, if you wait to enroll in your birthday month, let's say your birthday is March 2nd, and you wait to enroll until March, then you're not going to be covered until April. And if you wait to enroll till April, because you still won't get a penalty in that case, you're not going to be covered until June. So it's advantageous for you, for multiple reasons, to apply to enroll for your birthday month. And that means you're due to start the first day of your birthday month. That's what you want to do. If by chance you're taking Social Security already, then enrolling is automatic. And if you're not, it's very easy to do. And I have step-by-step instructions I'd be more than happy to share with you. You enroll via the Social Security site. And I have to tell you, I'm a big doubter in big bureaucracies in general, much less the federal government. But even during this crazy period of COVID, Social Security has been processing Medicare enrollments in a very timely way. I've been really impressed with the work they're going. So it's nice not to have to worry about that at this time. Those are the basics of Medicare. Who's eligible, when to enroll, what the parts and plans are, how Part A and B, original Medicare from the government works, and then how the other solutions work together to fill the gaps, whether you choose the path that incorporates original Medicare, Medicare supplement, and a Part D drug plan, or Medicare Advantage, in which the private insurance company actually takes over management of your original Medicare and is actually compensated by the federal government to do so. You also learned when to enroll. And I always urge you, just what I want you to take away is as soon as possible. As soon as you can, don't dawdle. Just get it done. And then it's going to bring you a big set, a lot of relief. Trust me, I see it happen every day. So how do you go about deciding, do I want a Medicare supplement plus a drug plan, or do I want a Medicare Advantage plan? Even if I know that I want a Medicare supplement because I get this and I get the advantage of it, how do I know which one I want? And am I going to be able to pay for it? So the next thing you want to do is to prioritize your Medicare plan needs. And it's a great thing to do. You want to do it before you're in any kind of active conversation with someone from an insurance company or any other kind of guide, because you want to be clear on what you're looking for, and that has to frame your decision making. The first thing that you want to do is to inventory your healthcare usage, wants, and preferences. Now, again, take me, for example. I'm lucky enough, I've run a business for a long time, and I'm lucky enough that my husband has a healthcare plan that I'm on. And it's a small company, they only offered one. So I really haven't had to think too much about what's most important for me in my healthcare coverage. But now, as you're entering Medicare, things are different. And now's the time to start doing that kind of processing of what's most important. You want to inventory how frequently you see what doctors, what kind of medical conditions you have. Write it down, because you're going to need this in front of you as you move forward with enrolling in your Medicare coverage. Do you have are you loyal to specific doctors, or maybe it's just one or two of your doctors? What medications are you on? Are there generics that you can substitute that may be less expensive? Because remember, you're paying for all of this now. No employer, there's no big daddy taking care of it. And that's really a shock for a lot of people. You want to think about how much you spent last year. What did you spend for your, usually these days people contribute to the monthly premium, as well as there are lots of co-insurance, co-pays, co-insurance, deductibles and that kind of thing. It's important to have a clear idea of what you paid out of pocket for all your medical costs in the last year, so that you have that as a baseline when you're looking forward to, and you're looking at the costs that are going to be associated with your Medicare coverage. It shouldn't all come down to cost, but let's be realistic. Cost is a pretty vital element there. So this is really a very, very important step. And it's something that I want you to start wherever you are in the process. I want you to start doing this now. Definitely, at least if you're not already past it, 4 months before you're going to be enrolled in Medicare. Once you have an inventory, and that's going to give you just a clearer idea of what your right now needs are, and also surface some of your preferences. Do you hate going to this pharmacy? You'll only go to this one. Is it worth money? You're going to pay extra for that privilege. Do you not really like your primary care doctor? So you just as well find a new one that's in a Medicare Advantage network. These are all the kind of things you want to examine in your self-Medicare audit. Once you have that, a sort of general outline of what you're looking for, you want to ask some questions. You want to ask your primary care physician and other favorite doctors if they accept Medicare. Are they part of that 96% that does accept Medicare? It's likely they will be. A lot of the 4% of medical providers who don't are like the concierge physicians in the city, or researchers who are mainly research oriented and see few patients. If the answer is yes, they do accept Medicare, then you want to ask them, if you're considering Medicare Advantage, what plans they participate in. So if you're loyal to any physician, then, and you're going to go Medicare Advantage, see, with critical thing I forgot to mention, with Medicare Supplement, you have absolute flexibility. You can go to any doctor who accepts Medicare, no matter where they are. So if you want to go into the city for that second opinion or that specialized treatment that's not available here, you can, and you're going to be covered at the same level. You want to ask yourself, and if you're affiliated, if you've been in the military, explore if there are any other coverage options. If you're a veteran, there are definitely some options that can substitute for or supplement parts of Medicare, and that's something you definitely want to explore. If you're working past 65, talk to your HR department or benefits coordinator about how that works. How is it going to work if you're going to stay on the employer coverage? If you stay on if you're retiring, is there retiree coverage? How much does that cost? You want to really ask and do your due diligence so that you're aware of, once you have your basic wants defined, you're aware of other variables that are come into play. Whatever you do, though, please don't ask your friends, your colleagues, your family members which plan to get. Going back to my very first slide, there is no best Medicare plan. You have to get the right coverage for you. It can be very confusing, especially because Medicare is so complex, to get input from so many different people. This process will allow you to prioritize what matters most. Do you need predictable expenses? Then a Medicare supplement's for you. Or are you fond of it? Okay, Medicare supplement. Do you need long-term access to the doctor you have confidence in? Well, you could go either way. It's just in that case, supplement or Medicare Advantage. It just depends what Medicare Advantage networks the doctor is affiliated with. Do you want vision and dental coverage? Now, I have to say, vision and dental coverage is something that's often included on employer plans, and everybody asks me about it. When they shift to Medicare, seldom makes sense, seldom worth the investment. Are you on a very tight fixed budget and you really can't pay ahead as required by a Medicare supplement premium? You have to pay that premium at the top of every month. If you can't do it and you just have to risk going, being hit with expenses as you go along, you have to go Medicare Advantage. Another question may be, do you in normal times, do you like to travel? Do you go somewhere for a couple months in the summer or the winter? Well, that indicates in most cases you're going to need a Medicare supplement. But you're going to write all this down, you're going to prioritize what matters most, and that's going to allow then the expert that you connect with to drill down and match the right Medicare plans with you. Whoops. Sorry about that. So to find a Medicare guide you can rely on, you kind of have to be a hard ass with this, I gotta say. You gotta interview the guy, you gotta make the guide, you gotta make sure that the person is reliable, that the person is experienced, of course, that they're licensed in the state that you're living. I have no idea if anyone is here from outside New Jersey. You want to ask that person what kind of insurance they specialize in. If they do everything, that's not good. Medicare is really, really complicated. And there are a lot of people who focus only on Medicare, or at least only on health insurance. You want somebody to have a very focused experience and expertise in Medicare. Do they work for one company? That's called a captive agent. Do they work for one company like Aetna, or are they independent where they represent all the top brokers so they can match you with really the right plan no matter where it comes from? And you want to ask what is your fee for doing this work? My fee as a broker, there is no fee. I'm compensated equally by every insurance company. You pay a commission for an insurance policy. If you called up for your auto insurance, you called up Geico directly and you did it, they keep the commission. However, if you went through an agent to purchase that policy, which then the commission would go through the agent. But to the consumer, there's no fee. You also want to ask, I would ask if I was looking, can you give me a couple of references? I'm someone, I like to research things, so I'd want to talk to at least one person they've worked with that's in my situation. And ask around. It's always good to ask around. We're all in the same area, or most of us. Ask around. What do people say about that person? It's really important to be confident in your guide. The guide's going to listen to what you deliver, and you're going to have a good sense at this point. Of course, you know what your dates are. You're going to know what your priorities are. You're going to know your medical history, habits, usage, not only your needs, but your wants and your preferences. Those are all important. That person ideally should ask for your information before you meet so no one's time is wasted. And then you get together and you discuss what that person has to say based on the information you provided up front. That person should continue to build on this very basic understanding of Medicare you're gaining here and what you're going to gain as you continue to do your own look-see into Medicare. That person should listen closely to your preferences and choices. And it's one thing that really surprises. This is a very emotional process for people. There's a feeling of vulnerability. And for those of you who've had to provide your own health insurance for yourselves and your families, you know what I'm talking about. And this is really the same kind of thing. So you need someone who hears your preferences, who hears your concern, and is really able to, taking all that into account, assess your needs for complementary coverage, whether it's a Medicare supplement and a Part D or Medicare Advantage, and then is able to recommend maybe 2 or no more than 3 plans to you, is able to discuss them with you, the pros and cons of each, if there are distinct pros and cons. And you, based on all the work you've done starting tonight, are able to make an educated selection and enroll. So that's putting your 3-part Medicare solution to work. And the result is a comprehensive Medicare coverage that matches your need and your budget. Even more importantly, it's the peace of mind that comes in knowing you have the right Medicare coverage in place. So Joanne, I want to stop my share here and I want to open it up to questions.
Okay, Nancy, thank you. Yes, we do have some questions.
Great.
And I'm going to jump around with them here. But first, can you kind of clarify the Medicare supplement does not cover dental and vision at all?
It does not. There is no dental coverage. Now, if you have an eye condition that would be handled by an ophthalmologist, some kind of eye surgery, that type of thing, that will be covered by a Medicare supplement, but the average eye checkup, glasses replacement, that kind of thing is not covered. It can be covered by networks within Medicare Advantage.
Okay, thanks, Nancy. And
Sure.
how much of this is New Jersey specific, or is it all universal?
No, this is very New Jersey specific. It's a great question because, for example, I do a lot of work in New York too, and New York has really great consumer protections for healthcare. So if you're a New York resident, for example, there are no what that excess charges, that additional 15% of charges a doctor can charge you. Those aren't there aren't any in New York.
Wow.
So
okay. Now, if you have coverage through your spouse, can you or should you wait to enroll until your spouse's coverage ends?
that is a really that's a great question. It's also common the other way, the spouse who's further behind. Now, if you have coverage through your spouse, what you want to do is to look at very specifically how much you're paying for the addition of your coverage to that policy. And you want to get what's called a statement of benefits. And then you'll see very clearly what you pay in terms of, beyond the premium, copays, coinsurance, and deductibles. And you want to compare that to what you pay with Medicare, original Medicare, and the complementary, either one of the complementary methods I mentioned.
Yes, that makes sense. Okay. Under what, if any, circumstances does Medicare pay for home care?
So if you've been in the hospital for 3 days and more, or more, 3 overnights or more, then sometimes Medicare does pay for some home care. It's very case specific.
Okay, thanks.
It does not pay for long-term care of any sort, ever.
Okay, thank you, Nancy. And there is one more question, unless anybody wants to add. If you're currently on Medicaid, how does that affect your decision to sign up for Medicare?
Well, actually, there are special policies called dual special needs policies that are available for people who are on Medicaid, and they enter Medicare with Medicaid. The two work together, and that's a real specialty as well. Typically, those are Medicare Advantage plans.
Gotcha. Okay. There's another question. I'm 65 and continuing to work with healthcare coverage. Should I go ahead and sign up for Part A just to get into the system?
Oh, wow. This is like a setup. These are the greatest questions ever. So, part A is hospitalization, hospital coverage, the room and board coverage. And as I said, if you've worked for 40 quarters or a total of 10 years and pay taxes on that, then you've already paid the premium for the rest of your life on that. So, in general, it always makes sense to enroll in Part A. There's no reason not to. There is one exception, however. If you are contributing to a health savings account through your employer, you don't, and you want to continue doing that, you have to stop contributing to your health savings account 6 months before you enroll in Part A. If you want to continue that contribution, you'll hold off on Part A. But otherwise, it's a wonderful way to backfill in some of those same gaps in your regular, in the employer health coverage for hospitalization.
All right. And if you are staying on your spouse's plan, say your spouse is younger, you're staying on their plan, do you have to do anything at 65?
You don't have to do, you don't have to do, if you're taking Social Security and you do not want to enroll, then you have to make that request through the Social Security office.
Isn't this
Otherwise,
I keep hearing about you paying more later if you don't enroll at 65.
no, actually, that's a great question. There's a lot of confusion about it. So you're, as long as you have what's called, the government, believe it or not, is really concerned about people being covered. So they're trying to avoid people being uncovered, knowing how it just, weighs down the healthcare system. So you want to, as long as you're covered by what's called credible coverage, that's the coverage that's equivalent to Part B, and most employer coverage that every employer coverage I've ever heard of is more than equivalent to Part B. You're fine in delaying. And then you get what's called when the employer coverage comes to an end, you get what's called a special enrollment period. And you have a certain number of months after the time that your employer coverage ends to enroll in Medicare without penalty.
And can you talk a little bit more about, you mentioned penalty for signing up late. Can you tell us more about that?
Yeah. So, well, here's a common example. I was just helping someone with this. A couple I know, the guy was on the woman's insurance. He was older. She was furloughed or permanently, professor at the new school. She took the Great Cobra for both of them, just continuing with their existing policy. Now, Cobra, as you know what sometimes people think the devil you know is better than the devil you don't know. But the problem is they stayed with Cobra for the full 18 months, which is the extent of time that Cobra lasts. The problem with that is that the special enrollment period after you leave in employer coverage is only 8 months. So there was almost a full year that they should have been they should have enrolled in original Medicare, and they were on Cobra, which is not considered creditable coverage. And that's because it's temporary. It's not permanent, it's temporary. So they have a penalty to pay. It's 10% of your Part B premiums for an entire year. And that gets carried with you as long as you go. There's also a penalty for not having creditable drug coverage. So, for your medications, so that even though in this same example, you have 8 months after your employer coverage ends to enroll in parts A and B, original Medicare, you only have 2 months to enroll in Medicare Advantage if you want that, or a Part D prescription plan if you want to go with a Medicare supplement. Now, if you look at that and you realize, oh, I can't enroll in a drug plan or I can't enroll in a Medicare Advantage until I'm enrolled in, well, actually, you could be in Part A. But anyway, you want to do it promptly. You never want to wait to the end of an enrollment period because that Part B penalty is hefty and lasts forever.
Okay. And let's see, should you enroll for Medicare, but still be under 26? Okay. Maggie, I'm not sure I understand. Maggie, can you unmute and say that question?
Yes, sorry about that. Okay, what would you suggest you do if you still have children under 26 who you've been carrying on a family policy?
The exchange, yeah. It's tough. And, honestly, people who have been on the exchange, the people who are really walloped with an increase their costs, and, first of all, the family thing, if you take yourself out in some, in many cases, one parent, there's an age difference. So if, let's say, the older parent turns 65, enrolls in Medicare, still the rest of the family, let's say they're 2 kids under 26 and the other partner are on it, that does not save you that much money. It doesn't save you as much money as it would think. And if you're in a situation where you have, kids or young adults under 26, they can, and that's definitely a benefit. Part of the ACA that they're covered by your insurance, but they have to go on the exchange.
Okay, and what if I
Thank you.
stop? What if I stop HSA contributions and then sign up for Part A shortly thereafter? In other words, before waiting 6 months, what's the penalty? And why 6 months? Where's that 6 month thing come in?
Yeah, I have no idea why that 6 months come in. There's so many arbitrary rules with Medicare as there are with many governmental operations. I have no idea. But I can, let's see, Vince, if you can email me at nancy@smartmedicare.com. Forgot to show my info. But that's how you guys can reach me, and I'm glad to answer any questions. I'm going to look that up and I'll have the answer for you and we'll email you back.
Okay, thank you.
Okay, Nancy, you have answered a lot of questions. Anybody else have anything? So Nancy, you'll be getting in touch with, if it's okay with everybody, Nancy will be getting in touch with you so that she can share her resources. Vince, can I ask you to mute?
Yeah, so I'm going to be, Joanne's going to get me your emails tomorrow. I'm only going to send you one email. It'll have a big opt-out opportunity. I will not blast you with email. But what I do have to send you is a 2-page flyer that summarizes all the costs associated with original Medicare parts A and B. And that's important information that gives you a sort of a baseline of what you can expect. And then you'll see what you will be looking to cover by either a Medicare supplement plus a drug plan or a Medicare Advantage plan. And feel free, as I said, I'm at nancy@smartmedicare.com. That's more memorable than my phone number, believe me. But I really love to help people with this. It's going to be a big relief when you get to the right coverage, and it can be done in this systematic 3-part way that I reviewed with you today. So please let me help you in any way I can.
Wow, Nancy, thank you. And like I said, this meeting is recorded, so we'll probably be putting it on our YouTube channel at some point. And I think that Kathy,
I have a question. I'm sorry, I went into the last minute.
go ahead, Claudine.
Great.
Hi. If someone currently in a plan, is it true that you have to the end of March if you don't like it to make a switch?
Yes, that is, and that's a really good thing. I really didn't get into other enrollment periods, but it doesn't stop. It's not a one and done thing. And as, I'm sorry, what is your name? Who's asking?
Claudine, I'm not quite,
Claudine.
yes, I am
Yeah.
not quite yet a senior, but I'm the one
Okay.
that take care of my mom's stuff. So
Oh, great.
I
Well,
try to
that's
educate
good
myself as much
practice,
as
Claudine.
possible.
Good
Thank you.
practice. Yeah, so, just to give a little context for this, it's not as much as we want this kind of decision to be done when we make it, it's not done. Drug plans and Medicare Advantage plans change every year. So you really want to be doing what I call an annual Medicare checkup. And every fall is the main time. It's called annual enrollment period from October 15th to December 7th, when you can make those changes. You can change your Medicare supplement at any time. There's no reason to do that until other than every 2 or 3 years. I'd like to look at people's plans because lots of times you can get the same coverage at a less expensive price if you're healthy enough to pass underwriting, which is part of Medicare supplement replacement, not part of Medicare Advantage replacement. You can save money frequently by switching insurance carriers. Now, Claudine, you're right. This is an unusual period from January 1st through March 31st, where people with Medicare Advantage plans, whether they selected a new plan just this fall, or they have one they didn't get to make a change in the fall, they're able to change either to a different Medicare Advantage plan, back to their old one, or actually leave Medicare Advantage and go to original Medicare and just a drug plan. What are you thinking about for your mom, Claudine?
Right now I chose the Braven health for her. But as time passes, I'm learning a little bit more. So I think I still need to educate myself more about it to know by March if that's the right plan for her. And I
Well,
would like much to speak with you.
that's good. That's good. I mean, Claudine, that's just what this period is designed for. And as I mentioned, Medicare Advantage plans are really hard to sort of get a handle on. I had a client, a really good, a friend of mine through Garden Club, and I moved him to this Medicare Advantage plan. He had been on a Medicare Advantage plan. I moved him to a new one that was going to really generate significant savings and provide the same kind of coverage. And of course, one of the things you check with Medicare Advantage, because they do have these Medicare Advantage plans, limited networks of doctors and hospitals, you want to make sure someone's preferred doctors are on there. So at first, of course, I did that. And this gentleman does have some medical conditions, making it even more important. And yes, everybody was on there. And then January 2nd, I get a phone call from him, or maybe it was January 3rd. And he tells me that he was to his primary care practitioner. And as of January 1st, they're no longer on the plan. Atlantic Health System, a huge health system. So,
Wow.
you know, this information that you work with and I work with is only, it's old the minute it gets posted. It's already out of date. And that really can matter whether it's Medicare Advantage or a drug plan, where they're constantly revising drug prices too, based on negotiations with the pharmaceutical companies.
Nancy, can we sneak in one more quick question?
Definitely, my pleasure.
Are contributions to an FSA allowed if you enroll at 65 but plan to continue working?
An FSA. What is an FSA?
Kathy, what is an FSA?
It's a flexible spending account.
Oh, flexible, right. I've always wanted one of those, Kathy. That's why it didn't come right to mind. But that's a good question. I believe so. But Kathy, I'm writing this down and I'll have your email tomorrow and I'm going to look that up. You know what I'm going to do? I'm going to include these answers in the email to everybody, just in case you're interested.
Sounds great, Nancy. Everybody, thank you for coming. I hope that you got as much out of this as I did. I learned a lot. And Nancy will be in touch. And thank you all for coming. And thank you, Nancy.
Well, thank you. It's really been a treat to work with you all tonight.
Good night, everybody.
Thank you, Nancy. This was wonderful. Thank you so much.
You're welcome.
Yeah.
Bye-bye.